Hi, this is Paul Wise and welcome to the Lawn Vet video series. In this short video I'll be sharing with you some information on hyperthyroidism in the cat. So what is hyperthyroidism? Hyperthyroidism is the most common hormonal disorder that affects cats, with an incidence of around 10% of cats over the age of 10. It creates a wide range of signs resulting from the overproduction of thyroid hormone made by the thyroid glands, which are situated in the neck. Cats have two thyroid glands. In the vast majority of cases, hyperthyroidism in cats is caused by a benign growth in one or possibly both glands. Rarely, in less than 1 to 2% of cases, the hyperthyroidism is caused by a malignant tumour, such as a thyroid adenocarcinoma. What are the signs of hyperthyroidism? Hyperthyroidism can occur in any breed of cat, male or female, but occurs almost exclusively in older animals. The youngest I've personally seen was 7 years old. The classic signs of hyperthyroidism are weight loss, usually good appetite, though occasionally you will see cats that aren't eating very well, increased thirst, increased activity, restlessness or irritability, a poor unkept coat, mild to moderate diarrhea and sometimes vomiting. In some cases there may be generalised weakness, lethargy and loss of appetite. An increased heart rate and heart failure is one of the more common presenting signs. Why should you care about the condition? Well, hyperthyroidism will kill your cat if left untreated, and it is a condition which in general leads itself to treatment, with most cases responding very well if treatment is begun early enough. Unfortunately, some cases are presented at a late stage, in extreme heart failure, with their chest full of fluid, which squashes their lungs, and sometimes they can have acute blindness due to high blood pressure, which leads to retinal detachment, and occasionally they can get a blood clot. Sadly, those cases are usually terminal. So how do we diagnose hyperthyroidism? In most cases it is possible to palpate an enlargement of the thyroid gland in the neck. Occasionally though, there may not be a palpable goiter. In all cases the condition is usually confirmed by blood testing. How do we treat the condition? Successfully treated cats, irrespective of what treatment is used, will usually have complete reversal of all the signs. Further evaluation will usually be needed periodically to check the blood cells, assess kidney function and ensure the long-term goals of thyroid hormone concentrations are being achieved. There are 4 main options for treatment, each with advantages and disadvantages. Medical management, for example with antithyroid drugs. The most commonly used are the antithyroid drugs belonging to the group the thioamides. These drugs are available in tablet form and they reduce both the production and release of thyroid hormone from the thyroid gland. They do not provide a cure, but they do allow either short-term or long-term control of the hyperthyroidism. However, to maintain control of the disease, the medication has to be given at least on a daily basis, and usually twice daily is considered the best. The treatment dose is adjusted to effect, and these drugs are usually both safe and effective. Surgical thyroidectomy, the removal of affected thyroid tissues, can be used to control the problem and is a common treatment for many hyperthyroid cats. In general, this is a very successful treatment and can produce long-term or even a permanent cure in cats. However, occasionally signs of hyperthyroidism develop again at a later time if previously unaffected thyroid tissue becomes diseased. To reduce anaesthetic and surgical complications where possible, cats should be initially stabilised using anti-thyroid drug therapy before the surgery is performed. The major risk associated with the surgery itself is inadvertent damage to the parathyroid glands. These are small glands that lie very close to the thyroid gland. In fact, one of the parathyroids is inside. They have a crucial role in maintaining stable blood calcium levels. This complication arises when a bilateral thyroidectomy is performed in about 10% of cases. We don't see this issue in unilateral thyroidectomies, as the other side of the thyroid gland that has an intact parathyroid will provide adequate controls of calcium levels. After surgery, occasional blood tests are recommended to ensure the normal thyroid hormone levels are being maintained. More recently, radioactive iodine has been developed, and this is a safe and effective treatment for hyperthyroidism. Because cats are temporarily radioactive, they have to be kept hospitalised for short periods of time after treatment as a precaution. Unfortunately, this treatment is only available at certain centres. Following that treatment, occasional blood testing again is recommended to ensure that the normal thyroid levels are being maintained. A new option that has more recently become available for managing hyperthyroid cats is to feed them on a special diet that has strictly controlled levels of iodine. As iodine is used by the thyroid gland to make thyroid hormones, if there is only sufficient iodine in the diet to make normal levels of these hormones, this can help to control the disease. It does, however, require feeding a special prescription diet, and cats need to consume this diet exclusively to ensure effective control, and this does limit its usefulness. Most foods contain a lot of iodine, and your cat cannot eat anything else. So this method can only be used in single cat households where your cat has no access to the outside. As always, if having watched this video you have any questions, then please phone or email the surgery. We're here to personally help give you the very best advice and treatment possible for your much loved pet. Thanks for watching, and any feedback regarding this video would be very much appreciated.